This video is about how to choose a Medicare plan. We'll discuss the basics of Medicare and all of your options. There's only 5 options when it comes to choosing a Medicare plan. The first of the 5 options is Original Medicare by itself. Not too many people have Original Medicare by itself, but it is an option. The next option is Group Health Insurance. Group Health Insurance comes in 2 types, Employee Group and Retiree Group. If you're covered under Employee Group Health Insurance, you don't need to get your Medicare Part A, B, or D, as long as your insurance at your work covers more than 20 employees and that insurance is considered creditable coverage. If you're covered under Retiree Group Insurance, then in most circumstances you're going to need your A and B to go along with that Retiree Group Insurance. Notice we didn't discuss COBRA. COBRA is not considered creditable coverage if you're Medicare eligible. The next option is a Medicare Supplement. A Medicare Supplement is, and only is, a federally standardized Medigap policy. We'll go into more details in a couple slides. The next option is Medicare Advantage. Medicare Advantage plans are network-based, very similar to the group and individual insurance you've experienced all your life. The final option is Medicare and Medicaid. That's where the state and federal government partner together to take care of premiums and copays for low-income Medicare beneficiaries. Let's talk about Medicare Supplements. If you're getting close to your 65th birthday, you may have noticed an abundance of direct mail from insurance companies. What they're trying to do is sell you their Medicare Supplement. What you may not know is there's over 60 companies in many areas offering the exact same federally standardized Medicare plans. That's why it's really important to do your shopping. When choosing a Medicare Advantage plan, it's important to note that the plans vary by zip code. So a plan in one part of the country may have a similar name to a plan in your neck of the woods, but the plan will be different. There are many plans offered in many areas. Some areas have more than 60 plans. Many companies offering different plans with different networks all have the same set of federally standardized benefits. Just note the copays will be different and the networks will be different. Medicare Advantage plans are the plans that offer extra items like dental insurance, vision, hearing, over-the-counter benefits, and transportation. Not all of those extra benefits are in every plan, so it's important again to do your shopping. Let's brush up on some definitions as they relate to Medicare specifically. A copay is the amount of money that you would pay in exchange for a service. A deductible is the amount of money that you must pay before the plan pays. The network is a list of providers associated with a specific plan, and the out-of-pocket maximum is the amount of money you'd be responsible to pay for medical expenses, excluding prescription drugs, in a calendar year. Let's compare and contrast how you'll experience using the 2 major programs. On the left side, you'll find Medicare Supplement. That's actually where Medicare is your insurance, and a federally standardized Medigap plan, in this case Plan G, will pay the balance of the bill as instructed by Medicare. On the right side is Medicare Advantage, and there are multiple different types of Medicare Advantage programs. Let's go to the left. With Medicare as your insurance and a Medigap Plan G, you can go to any doctor, any hospital, anywhere in the United States. Now, if you've heard from friends and family that, ooh, this doctor doesn't take Medicare, that's not exactly how it works. 96% of all providers in the United States participate in Medicare. 3% are considered non-participating. You can still go. They charge over Medicare's allowable amounts, but the Medigap plan will pay that difference for you, so that adds up to 99%. 1% left over. These are the doctors that are opted out of Medicare. They're considered concierge physicians. If you have one now, you know it because you're paying a concierge fee. Those doctors will allow you to maintain the relationship by continuing to pay the concierge fee. Medicare won't offset their charges. So let's continue. With Medicare and a Medigap, the Medicare Supplement side, there will be no copay for medical services. The annual deductible is listed above. The out-of-pocket maximum is equal to the deductible for the year. That's the most amount of money you could possibly pay for medical services. You'll be adding a prescription drug plan. Sometimes the left column is called the a la carte menu. You'll be selecting a Medicare plan, or in specific, a Medicare supplement from one company, and you'll be picking a prescription drug plan from another company to complete your package. The most popular reason people select from the left column is freedom of choice, to use any doctor, any hospital, anywhere in the United States, and no referrals will be required. Moving over to the Medicare Advantage side, these are network-based programs. In most metropolitan areas, you'll find that many of your doctors are on many of the networks, making it pretty easy to maintain those relationships. You will have copays and coinsurance for all services. Most of the plans will not have a deductible for medical services. The out-of-pocket maximum ranges greatly, so it's important to do your shopping. The prescription drug plan is usually included. People pick these plans because they typically have no monthly premium over the cost of Medicare. You'd only pick the plan if you got to maintain your medical relationships. The drug benefits built in, and they're easy to use. I'm sure you're curious as to what the costs associated with each of these plans would be on a monthly basis. Well, let's take a look. Medicare Part A is $0 on both sides. The Part B premium for the current year is listed, and you'll notice it's the same. The Medicare Advantage plans have no monthly premium on the right, whereas the Medigap plan will have a monthly premium. The Medicare Part D premium is included on the Medicare Advantage plan, and there's a separate charge on the left. Remember, the left side is considered the a la carte menu. Medicare being your insurance, you'll get a Medigap plan from one company, you'll get a Part D prescription drug plan, most appropriate for you, from another company, adding up to the total listed here. On the left side, after the deductible is satisfied for the year, the only thing you would have to pay for is prescription copays. On the right side with Medicare Advantage, you'll have copays for doctors, hospitals, and of course your prescription drugs. Medicare Supplements, or Medigap plans as they're officially known, are offered by insurance companies under very strict guidelines. A Medicare Supplement plan from one company is exactly the same as a Medicare Supplement of the same letter offered by another company. Medicare Advantage plans have federally standardized benefits, but your copays will differ by plan. Selecting a Medicare Advantage plan may have more to do with the choice of doctors and hospitals offered by a particular plan than the premium, brand name, or even the plan rating. If you're like me and you want to do your research in the most in-depth way possible, may I suggest our book, Medicare Made 1, 2, 3 Easy. It's available everywhere books are sold, Amazon, Barnes & Noble, and it may even be in your local library. Here are a couple great sources of information. Medicare.gov is the only place that you can go to enroll in your A and B of Medicare. It's also the only source that will provide you the cost of prescription drugs on every plan available in your zip code. 123easymedicare.com, that's our website. That's our source to provide you with information when you're considering going on to Medicare, once you've already gotten your Medicare, and taking a look at your options year after year to make sure you have the most appropriate Medicare plan once you're on Medicare. Looking for more information? Well, we're here to help. Every month we publish our newsletter called the American Retirement Advisor. It's chock full of information for folks that are approaching Medicare and already on Medicare. The Medicare Moment column is picked up by the Associated Press every month, and you'll find our articles all over the country in local newspapers. It's a free publication. It's our pleasure to get that out to you every single month, either in digital form or printed form. Just let us know. Are you considering Medicare Supplements? Would it be helpful to have a single document with the rates for every single company in your zip code based on your gender, your age, and whether you smoke or not? Well, let us know. We'll be happy to sit down and prepare that information with you so that way you'll know exactly what you're looking at. It's our pleasure. Considering Medicare Advantage? Well, would it be helpful to compare every one of the plans available in your zip code side by side in columns so you could see the copays you'd be responsible for? Well, it's our pleasure. Let us know. We'll sit down with you and get that information built specifically for your needs. Need even more information or want a refresher? Well, attend a workshop. We have them every single month online nationwide. Just click the little green button on our website at 123easymedicare.com. It says attend a workshop. It's our pleasure. Well, I hope you found this video helpful, and as always, we're here to help.